Hello, my name is Dr. Lauren Hack, and I am a clinical psychology fellow with over 10 years' experience researching, evaluating, and treating childhood ADHD. I would like to talk to you today about a new study coming out of the University of California, San Francisco, investigating a phenomenon called the depression distortion hypothesis in a sample of children diagnosed with ADHD, predominantly inattentive presentation. First, let's talk about why this topic is important. So unlike some medical disorders like diabetes, which can be diagnosed with a simple blood test, diagnosing ADHD is much more complex. Our gold standard is a comprehensive assessment, which means integrating evidence from multiple sources, multiple modes, and multiple settings. However, more often in typical practice, clinicians rely solely or predominantly on parent reports of psychopathology from a symptom checklist, such as this one. And why is this potentially problematic? At least a subset of parents over-report psychopathology, which means relying solely on parental reports of ADHD can lead to inaccurate and inappropriate diagnoses and treatment planning. A leading explanation for this is the phenomenon called the depression distortion hypothesis, which theorizes that parents with higher levels of depression hold more negative schemas for their child's misbehavior and thus over-report the severity and/or frequency of this behavior on rating scales. One can imagine how cognitive errors may influence a parent's response style on rating scales. For example, many children experience difficulties in social situations. One mom may view an instance in which her child is having social difficulty and think, my child is always getting into fights because she's mean and bossy and she's always going to be like this. There's nothing I can do because I'm a lousy mom. However, another mom might view the exact same instance and think, my child had a bad day today on the playground. Maybe she didn't get enough sleep or was tired and cranky, and we can talk about problem-solving strategies tonight, and tomorrow will be a new day. So you can imagine how that first parent may overinflate their reports of their child's symptoms compared to the second parent. So to investigate this phenomenon specifically related to ADHD inattentive presentation, we examined data from 199 children and parents participating in a randomized controlled trial of a psychosocial intervention for ADHD inattentive presentation called the Child Life and Attention Skills Program, or the CLASS program. Parents completed a series of rating scales as part of their initial assessment for the trial, including ratings of child behavior, as well as ratings of their own depressive features and ADHD symptoms, and ratings of cognitive errors. We utilized a novel measure for cognitive errors entitled the Parent Cognitive Error Questionnaire, which assesses how parents think about their child's behavior and family functioning. One example item states, last week your child brought home a worksheet which he did incorrectly and now has to redo. You think to yourself, this is awful. Now he is struggling in school. So here we can see that parent is jumping to conclusions and displaying global and stable attributions for the child's misbehavior. So indeed, results from our study demonstrated positive associations between parental factors and inflated ratings of child ADHD. Our study results also demonstrated a cross-sectional mediational pathway, specifically higher levels of parental depressive and ADHD symptoms predicted higher levels of cognitive errors, which in turn predicted higher parental ratings of inattention. Findings provide evidence for the core tenets of the depression distortion hypothesis and also provide several clinical implications. To begin, correcting cognitive errors in family-based treatment for ADHD appears warranted. And indeed, the Child Life and Attention Skills Program, the CLASS program, dedicates an entire session to helping parents address their cognitive errors, which is labeled in parent-friendly language as correcting helpful and unhelpful thoughts. Ultimately, addressing cognitive errors in treatment can help parents view their children in a more positive light and also may encourage more positive parent-child interactions and positive treatment outcomes. And I'd like to encourage you to contact me with any questions, discussion points, or feedback at lauren.hack@ucsf.edu. Thank you for your time.